The Health Secretary, Jeremy Hunt, today vowed to drive through proposals for all consultants to work 7 days a week to raise standards in the NHS. The plan has been backed by doctors, but they want to know how the government will fund and staff it.
A new specialist emergency care hospital in Northumberland has been named by Mr Hunt as the model of the future for 7-day working. The Northumbria Specialist Emergency Care Hospital in Cramlington opened last month. Our reporter Katie Oakes has been to see how the team there is working.
More than 6,000 patients have come through the doors of Northumbria Specialist Emergency Hospital since it opened last month. Whenever they arrive and however serious their condition, doctors, nurses and a specialist team of consultants will be here, ready to diagnose and treat them.
As a trust, we passionately believe that patient care should be absolutely focused on the patients and optimising their time with us and doing our utmost to reduce mortality, complications and give the patients an excellent experience and service.
And do you think a 7-day working is key to that?
I think it is. For emergency care, I think it's essential.
Yeah, shortly. Right, pass that bill over there.
All clinical staff in this trust are on 7-day contracts, but that's not the case everywhere. And Health Secretary Jeremy Hunt wants to change that and has used this trust as a success story.
You are 15% more likely to die if you're admitted on a Sunday compared to being admitted on a Wednesday. No one could possibly say this was a system built around the needs of patients. Hospitals like Northumbria that have instituted 7-day working have seen staff morale transformed as a result.
But this hasn't happened here overnight.
Been in the planning or the implementation for over 10 years now, and obviously with the opening of the Northumbria Hospital, which took 7 years to plan and again was clinically led, it's taken a number of years to plan, which I think is really important. It takes time.
It's those conversations which unions argue haven't had time to happen.
I think there will be inordinate problems because we're not against the proposition and the thought that we'll go in that direction, but it's got to be properly negotiated, properly thought through.
I would have thought the Secretary of State should first of all focus on getting a 5-day service up and running before stretching it to a 7-day service, and then over that period look at the clinical evidence about how to provide the best service to patients.
Hundreds of miles away from the political noise at Westminster, Pamela Dyson is on Ward 3, quietly recovering from an operation.
So many people who, are in a desperate situation, and those desperate situations can't be foretold, whether it be a Tuesday afternoon or a Sunday morning early hours. So yes, it's the best way to go. It's got to be that way.
Jeremy Hunt wants all hospital doctors to follow the lead set by Northumbria and this new hospital by the end of Parliament, and has vowed to impose 7-day working if necessary. Katie Oakes, ITV News, Cramlington.